I've probably seen about 12 or 13 different types of specialists, including gastroenterology, neurology, cardiologists.
Our bodies are complex systems, and complex systems work together. They regulate each other.
When people wind up taking all these additional pharmaceuticals, you might notice even more side effects.
That's one of my big goals with patients is I want them to have, I tell them, I go, look, I don't need you to be a medical expert, but I want you to have enough knowledge about your body when you're done with me to at least advocate for yourself. The NeuroTrition Podcast is sponsored by North Florida Spine and Wellness and produced by Jumine Delmas Studios. Welcome back to the NeuroTrition Podcast. I'm Dr. Matthew Zaideman, and we are going to get real about what it takes to heal here on this episode. We're going to be talking with a medically complex patient, which is one of the most common type of patient that we see in our clinic. And we're going to get down to the differences between what it takes to do that and the different mindset that we don't see typically in traditional medicine. If you like some of this content, please don't forget to click that like button and subscribe. Today's guest is Sharon Surita. Sharon, thank you so much for joining us.
Absolutely. I truly appreciate you having me on the NeuroTrition Podcast because I know the important work that you do, especially in this space of functional neurology and how you address those complex brain-body symptoms that people often have overlooked.
Yeah, thank you. And I really, that means a lot. And it has been quite the evolution to get to that point. Not only, we've always kind of dabbled in, done some functional medicine, but you're right. You can't just stop with the physiology. You have to think about the neurology as well. And that's the whole theme of this podcast is connecting the brain and the body. So can you take us back to the beginning of your health journey?
Yeah, it's pretty complex, as you stated. Back in 2019, I had what was considered a routine hernia repair surgery, and it was with mesh. So I had already known of the complications related to polypropylene mesh, and I opted for a biologic mesh. However, what was implanted was a biosynthetic mesh, so it still had some of that polyester, that synthetic material, and my body did not like it. Now, that doesn't say that it doesn't happen with biologic mesh also, but, in my head as an environmental engineer, I knew I didn't want plastic in my body. So
makes sense.
Yeah. So I was thinking that I did have the biologic mesh, and maybe 2 or 3 days after surgery, I was feeling incredibly ill and beyond anything I had ever experienced. And I went to the emergency room on the behest of the nurse practitioner that was overseeing my case. And so this kind of became a repetitive thing. They couldn't figure out what was causing things like tachycardia. I had temperature dysregulation. My temperature was constantly around 101, and with no other indications of what was triggering that. And there was just a myriad of other symptoms that didn't correlate with what should have been seen in somebody recovering from surgery.
And when you went to the ER, and I'm assuming they pretty much just made sure you weren't dying, right?
Right.
and sent you home.
Right.
And probably said follow up with the surgeon or your primary care. That's typically what we hear. So when you went back, I'm assuming you went back and discussed this with the surgeon or the doctor who recommended the surgery. What was the path from there?
I did see, after surgery, they have a 3-month post-operative period. So I saw the surgeon multiple times, and he essentially told me that my symptoms had nothing to do with the surgery and that it was all like psychiatric, that it was all in my head, my mind, because everything was healing beautifully. Like the actual incisions were healing and there was no sign of infection. Blood work was normal, the CBC, the CMP, all of that looked relatively normal considering the surgery. And there was no idea of why I had such severe gastric symptoms following this, which it was a perpetual cycle of nausea, food intolerances, and I wound up dropping about 40 or 50 pounds because of the inability to eat. So at this point, I was becoming less and less mobile, less functional, and I was bedbound for about 4 months while this is happening. Granted, I was dismissed by that initial surgeon. I had seen following that at least 10 other surgeons trying to determine what was causing this, because it was spontaneous after surgery. I
Right.
had not experienced anything prior. And like many of your patients, probably I probably seen about 12 or 13 different types of specialists, including gastroenterology, neurology, cardiologist, and even went the psychiatric route because they led me to believe that it was in my head.
They probably start thinking, you're starting to convince you in some way, probably, that maybe this is in my head, right? I mean, I've seen that as well. And the amount of people who end up developing anxiety and depression through this is quite high, because they're being kind of gaslit about what's going on. And it's one thing to not understand the mechanism, and I think that's the scenario sometimes, that it's not that they don't necessarily care. I think it's they don't necessarily, because they can't make the connection because it wasn't in the textbook,
Mm-hmm.
is that they don't make that extra critical thinking step. You know, to back up a little bit, this hernia surgery, this is that mesh that's going to go across the abdominal area, right? That's where the mesh
Correct.
was located, right? Okay.
Correct. For me, it was
Just
the entire abdomen was covered with a sheet of that phase 6 mesh.
Right. So then we can start thinking, at least from a curious, that's how I always look at it. Like, I'm always curious about, why something is happening. Even if it doesn't necessarily make sense with, just right off the bat, my thought process kicks in to say, okay, this is interesting. Why is this happening? And then we can start thinking, well, okay, so we have this foreign object. It's, around her abdominal area. She's having abdominal symptoms. Is there some sort of, either autoimmune reaction, or did this impact somehow her neurology from her gut to her brain? Why, because all of your symptoms that you're describing already are kind of autonomic based. And what I mean by
Mm-hmm.
that are there symptoms that are regulated by our autonomic nervous system, how our gut moves, how our heart rate is monitored, how we regulate temperature. I think you mentioned fevers right off the bat. So all of these things can be dysregulated with that system, if that system gets disrupted. And we definitely see that, a lot. And this, not to go down a wormhole of like acupuncture and stuff like that, but this can happen a lot with kind of midline type of interventions, whether it's even scars or surgeries in general, where we can cut and disrupt meridian systems through that midline, which is really pretty interesting. So obviously you hit a dead end with traditional medicine pretty quickly, it sounds like. What made you look into functional medicine and different alternative therapies?
Yeah, so the first time that I was exposed to the word autonomic nervous system dysfunction, like I would never
Right.
have even thought to look that up.
Sure.
But it was in seeing a functional neurologist down south. And so he kind of taught me a little bit about the vagus nerve and the functioning and different types of treatments that I could follow with. But just ultimately starting that education and learning about adrenal function and things like that, but there was so much that needed to be put in place to actually see progress. So even after I did wind up having an explant surgery 4 months later, but even 2 years after, I hadn't recovered. I still had all of this dysautonomia, all of these neurologic symptoms that you were mentioning. And then finding out about the field of functional neurology, that was actually like the light bulb moment that there was something that could be done. There was a name to, I guess you could call it a diagnosis, even though sometimes it's not one that's regarded well in the Western medicine world.
That's for
Um,
sure.
so the dysautonomia, and it just kind of spiraled into a deep research for me to learn what I could do for myself and to actually provide that insight for other people, because we were all in, there were so many people in support groups that were all just kind of floundering, trying to figure out, is it pharmaceuticals that is going to help them with these symptoms so that they can return to function, to normal life. But yeah, that's kind of where it first started. And then, moving to the area and learning about your practice, I really learned more the hands-on approach that you offer, that there are so many things that can help that vestibular function. And so maybe that's something you can share with your audience, some of the things that were instrumental to a complex case such as mine.
Right. And I do remember when you came in, and it was helpful because you already had, you had some work with at least evaluations with a functional neurology doctor, and it gave me some insight off the bat. But it's really important when you have these types of symptoms, whether it be nausea, uh, m- uh, temperature regulation, um, digestive symptoms, all of these things that come into heart rate. It's becoming more and more common, and there's we extrapolate a lot of things about why these things are becoming more common. But when we do that, we want to look at the neurology and not just one thing. The vagus nerve is becoming a very popular topic, and there's all kind of vagus nerve simulators out there, and I love them. They're all probably beneficial to some degree. But one thing that you have to keep in mind is that same thing with the physiology is that you cannot look at one body part, let alone one neurological system in a vacuum, because that's not how they operate. Our bodies are complex systems, and complex systems work together. They regulate each other. And so, for instance, when we talk about the vagus nerve, we do have to look at vestibular function because the vestibular system works kind of hand in hand with the vagus nerve. And our vestibular system is, for people who don't know, that's our inner ear balance. So if you've ever had anything from motion sickness to vertigo to even an abnormal fear of heights, this is usually dysregulation in our vestibular system, which just kind of helps us keep the world flat as we ambulate and move through the environment. And so you do have to look at these different systems. And I've learned more and more that, we used to just do vagus nerve stimulation. And then I realized that, a certain percent of the time wasn't working because we weren't regulating the vestibular system. So there's so many chickens and there's so many eggs, and it's really important to be able to deal and at least address all of them. So when we got in more into functional medicine, and I know you've done lots of different testing. I feel like you had a lot of different testing even when you came into our office.
Mm-hmm.
What tests, it doesn't have to be just one, I guess, but what tests were like, man, this is something that's no one's ever done on me, and really gave you some different insight into your body that nothing else had before?
I want to say one that stands out in my memory, but it's not a good memory. It's a negative memory, was the tilt
Sure.
table test.
Okay.
That one is with the provocation where they inject the, I don't remember the name of the chemical, but in essence, it's to induce that cortisol response. So I did not have syncope during the testing. However, I felt dreadful the entire way. As soon as the table was inverted to 70 degrees, my blood pressure tanked to 70/40. And from there, I felt as if that pre-syncope sensation stayed with me, the extreme nausea. And the bad thing about this one is a conventional test, but it does provide insight into like the POTS symptoms, we'll say. Not everyone is diagnosed because they don't have syncope. So I didn't receive a diagnosis there. What I received was about a week-long bed stay after that because of how it triggered all of that dysfunction in the body, and didn't really understand. So it was a negative experience, but that's when I started really understanding the connection to all those pieces that you had just mentioned, that it's not just cardiac issue, it's not just a gastrointestinal issue. So it really kind of shined the light there, but then it made me realize that this also is not the process, and going through, and that's where kind of the transition happened for me to get into just functional medicine and not really rely on those 10 or 15-minute consults if I even had that amount of time with the traditional medicine.
And with from a functional medicine perspective, same question. What tests kind of really gave you some more insight? Which ones do you find really valuable that a lot of people probably don't even know that exist?
Yeah. So, in functional
Just
diagnostic
one. I'm just
nutrition,
kidding. You can go.
there's about 5 tests that I really liked when I saw how they connected the pieces together, and they're all functional lab tests that were done at home, like at my convenience. I didn't have to go to an office, although the guidance was appreciated. So the GI map, the stool analysis in combination with food sensitivity testing, and then the Dutch for the hormone panel and seeing the hormone metabolites. And then there's 2 others, the metabolic wellness panel and the mucosal barrier assessment. So I know it's a lot of big words, But all of those together, I worked with the clinical advisor to really see what's going on with the body and see what things were out of balance so that we could shift things. So even though I still have, I didn't mention it earlier, I still have some implants with respect to titanium clips from biopsies and other things like that, sutures,
Right.
of course. So those things, I'm probably not going to pursue an explant, so they're going to be a toxic burden on the body. But with these types of tests and doing the neuroplastic work that you all offer, all of that combined helps me to understand that I can eliminate all the other toxins that are coming at us every day. So whether it's nutrition wise or just exposure to air quality, water quality, and that kind of thing, the neuroplasticity piece was, I think, central. So if I had to boil it down to one thing, the one thing I was missing was that the neuroplasticity, because I was kind of stuck in that fight or flight mode, even with
Right.
the other testing.
Yeah, and that's a really good point. And, because if your body's always in fight and flight, it's going to be just by default going to create inflammation. That's what the sympathetic nervous system does, which is your fight and flight part of your nervous system. So that is something that has to be addressed for so many conditions. And all those tests you mentioned are such great tests. I mean, the GI map, I don't just to go into that one in particular, that test literally maps out your entire gut flora, everything from your good bacteria to imbalanced bacteria. So, some people think, oh, I can't ever take too much probiotics or too much prebiotics or too much fermented food. Actually, you can.
Mm-hmm.
The body's all about balance. So there's certain bacteria, for instances, that are very, very important to your normal flora, but when they get out of whack, they can actually even trigger autoimmune type of issues. So that's kind of going to blow probably some people's mind, but that test does that. It will look at parasites. It will look at inflammation. That said, we could even kind of look at, like you said, that gut barrier system. That's where, and a lot of people are starting to become more aware of these terms like leaky gut, which
Mm-hmm.
I'm not totally a great fan of that term, but that's just my own personal thing. But those are kind of things are really important to know. But then coming back, even circling back to when we talked about the vagus nerve actually keeps that regulated from a neurological standpoint. They actually did a study where, and it's kind of brutal when you think about it, but they essentially gave mice concussions on purpose. And when they gave the mice the concussion, they actually showed that those mice developed a leaky gut, and that was firmly because of the head injury and the neurological impact on the gut. And so that goes back into this whole, overall overarching theme that the body and the brain they're not mutually exclusive. They have to be dealt with together. So those are all really great tests that I love to do. Dutch test, also something that looks at hormones, and people don't realize, everyone wants their hormones checked, and I want a blood test for my hormones, but blood tests kind of stink for hormones. They don't really look at what's bioavailable for the body to use. And also something that you kind of alluded to when you were describing that test is, how is it being utilized? One of the big risk factors for breast cancer, for instance, is having, we hear about estrogen dependent breast cancer, for instance. That really goes into how the estrogen itself is not the enemy. It's how it's being metabolized and broken down, which creates that risk. And those can be looked at, everything from genetics to, like you said, you can look at genetics to see that weakness, but then you can actually measure it. And it's incredible to me when I tell patients like yourself that these tests even exist. They're like, why haven't this been done? Isn't that crazy that these things aren't being done on a regular basis?
Mm-hmm. And I have to admit that had I not gotten ill, I probably wouldn't be aware of all of the functional lab testing that is available. Because back then you go and you really just receive the bare minimum in terms of testing, and they would only dig a little deeper if there was, and I hate to say it this way, but if there was a diagnosis code that could be tied into why they were testing additional things.
100%. That really goes down into the overarching problem, is that the system is built to have a diagnostic code that legitimizes insurance coverage And the whole system is built on, and we talked about this in a previous episode, that it's really in a logarithm essentially for them. There's certain guidelines they have to follow, and they have to be able to basically identify a diagnosis that matches some sort of therapeutic intervention that is pharmaceutical or surgical, or maybe some sort of rehab and certain musculoskeletal or some other conditions. But there's no, when I was a kid, I always thought that you got sick and you went to the doctor and they tried to figure it out. They tried to figure out what was going on with you, and it hasn't taken me long being involved in the medical system to see that it could not be the furthest thing from the truth. It's not that at all. It's your primary care. And I think it used to be that way to some extent. I think primary care used to be the type of doctor that was actually at least trying to organize care, trying to maybe use different specialists to get some insight about something particular, but they were kind of trying to put all the pieces together to help you figure something out. Now it's just referral to whatever body part you have the symptom to, and they don't talk to each other. They're not interested in why. They're not interested in why and how all of these symptoms are interrelated. And I really believe that it's not because they don't want you to necessarily be better. It's because they're not trained to do that. And they're also trained to think that all of these things, how these things all work together, is silly and not an actual real thing, which is, it just doesn't make sense to me when, at least from a logical common sense perspective, if I disrupt the vagus nerve, you're going to have nausea, autonomic dysfunction, heart rate issues, problems regulating temperature. Doesn't that kind of make sense that those symptoms are going to come up?
Mm-hmm.
And to call it, just you're going crazy. And I'm curious how that affected you, both sides of this, like kind of going through that of, basically doctors telling you you're crazy, to circling back and realizing there's actually stuff that can be done and the system isn't telling you.
Right.
How did that affect? I'm curious on how that did emotionally and just everything else.
That is a tough one to get into because
Sure.
as you know, when you're in chronic illness and if you're being gaslit and you're not seeing any type of improvement in symptoms whatsoever, I did finally decide the psychiatric help might be something like a tool to use, even if it was to kind of numb that feeling of hopelessness that I had at that time. So, but what did happen was after I took whatever was prescribed, it was Zoloft and also Lexapro and things like that. There was another one that was also supposed to have a dual purpose, like or it was supposed to help with the nerve pain. Decepramine, I think it was called. I guess it doesn't really matter. But the point was when people wind up taking all these additional pharmaceuticals, you might notice even more side effects. And that's what began to happen with me. So I developed hyperhidrosis and a couple of other things that were even beyond what I had been feeling. And again, that was a pivot point for me. But it did take some time to get out of that thought process that if this didn't work, then nothing's going to work. And eventually, as I mentioned, when I found out about functional neurology, actually through the support group and really taking a look at that and everything that it had to offer, I went through the process of still working with functional medicine practitioners, and just each thing that I saw from my journals, because I did journal daily, like journaling the symptoms and hypersensitivities, and that mindset shift that happened over the course of 2 years, maybe, where the journal became more about what things I was able to do, what things were beautiful for me for that day, and just trying to find the positives, even though they were small. Sometimes if it was just looking outside the window and seeing the grass or the leaves in the trees swaying, like I had my eyesight. And so I focused on those things. And pivoting from there is why I decided to take up the education myself, really diving in and learning about the functional labs that you and I discussed already, Dr. Zaideman, and really using those tools as an advocacy effort for other people that were implant injured. So helping them obtain these labs and then really diving into the data analytics of what are the common threads between people experiencing implant illness and the symptoms.
And I know that's a big theme of your podcast, Functionally Enlightened. I love that name, by the way. And, so I think that pivots us to a great point. What do you recommend? I think I get into this mode that I've been doing this long enough that I have this bad assumption that people know that what I do is out there. And even though when I think about it, logically, I know that they don't. So sometimes it becomes this implied knowledge, I guess, you could say. What would you recommend to people who are watching this that, maybe not even have the severity of symptoms you do, but just don't feel good and aren't getting any help, or just, told, hey, your blood tests are normal, you're fine. Here's an antidepressant. Stop being crazy in my office.
Mhm.
What is your recommendation for those people to kind of start thinking about making some steps?
Yeah, you are your own best doctor. So, for one, no one's going to feel what you're feeling in your body at that given moment. Everyone feels them differently. So, even though some of the symptoms they correlate between various groups of patients, but really just advocating for yourself, taking a loved one or a friend or someone with you to the appointment so that they can take at least the notes so you can review it together afterwards. It's a stressful event for people who are chronically ill to go into a practice and knowing you only have a certain amount of time, and sometimes you never even actually speak to the doctor. So if that's the case and you're going the conventional route, I would say like you need that advocacy piece and maybe the support if you can find it. But above all of that, if you have the means to seek out a functional health provider, they're the ones who are going to dig deeper. They're the ones who are going to look at you, listen to you. They want to be, if they have no one to be able to speak to and to feel heard, then that's like the step one. That's the first step to healing. Like you want to be heard. You want the doctor to actually listen to everything that you have going
Right.
on. So that, I guess those two things are more about, you have to advocate for yourself. You have to, even if it's requesting assistance, like some of us do not have the monetary means to seek out functional health because of that whole
Sure.
landscape we talked about with insurance, and we won't get into that, but it, we have to kind of humble ourselves and ask for the help to seek the proper help for our function, our health.
Yeah, I agree with everything you say. And in fact, that's one of my big goals with patients is I want them to I tell them, I go, look, I don't need you to be a medical expert, but I want you to have enough knowledge about your body when you're done with me to at least advocate for yourself with other physicians, because I know, we still need this traditional medical system because, I mean, trust me, I mean, if I have a heart attack, I want to go to the hospital. I don't want to, I'm not the guy for you at that point in
Mm.
time, right? They are very good at critical care. And to me, that's, probably a whole other episode, but that's kind of the problem is that the whole system is built around crisis care instead of, body optimization.
Mhm.
But so it's really being able to advocate for yourself. And, really, even with functional medicine doctors, I would tell people, especially, even if you're, whoever you're working with, try to think about, are they kind of trying to explain to you why they're doing what they're doing? I think that's super important too. I think that's helpful too from a patient perspective, if nothing else, but psychologically, knowing the why behind the
Mhm.
therapies they're recommending, because that's going to give you more confidence. It's also going to build your education base, and that's going to even make you a stronger advocate for yourself because no one's going to care about your health more than you do.
Mm.
That's the bottom line. No matter how caring a physician is, at the end of the day, no one's going to care about your body more than yourself. And so the more you can know and advocate, and frankly, the other thing is too, is you hook yourself up with a doctor that actually can take a little feedback. Like, but, if you can say, hey, they're recommending this, but, if you know your body well enough, I always listen to my patients that, hey, but what about this? This may not happen because I usually react to this or whatever. Giving having a doctor that will listen to that feedback and not just blow you off and say, no, we're going to do what I'm going to say, I think is really important too, because you guys should be working on a team. It's your body and it should be a team effort, not just do what I say. I may still disagree with a patient after they bring some of that stuff up and I'll give my reasoning why, but at the same time, a lot of times they're right. if not most of the time, they're right. And I'll be honest, I had to learn that lesson the hard way in my first few years of practice, that that there were times where some of the people just know their bodies so well that they're going to kind of so there's value even from a practitioner side to listening to your patients. Well, Sharon, I really thank you for coming on. I think this is a really valuable podcast for so many different people out there who are not only struggling with really complex medical issues, who have, like you said, gone into this area of hopelessness, but also to people who just think that, I feel kind of lousy and this is the best it can be. I think a lot of people are going to be inspired that there are something that you can do. So again, if you like this content, please hit the like and subscribe button. And if you want to learn more about how you can help yourself, check out our clinic website at healthytallahassee.com. We do free consultation calls. We can discuss your issues and see if it's something that we can help you with. And don't forget to check out the Functionally Enlightened podcast as well. It is really good as well. Do you have a website for your podcast, or is it just on social?
Yeah, everything is Functionally Enlightened, so pretty easy. The website is functionallyenlightened.com, and all the handles Functionally Enlightened.
All right, awesome. And don't forget to check out the NeuroTrition Podcast at neurotritionpodcast.com or at NeuroTrition Podcast on Instagram, TikTok, YouTube, and Facebook. And we can't wait to see you on the next episode.